Thank you for coming in this morning to discuss your son Anthony. I feel we've made great progress with him and will be able to help understand and accommodate him a lot better.
I'm really glad to hear. I was starting to worry, and most people told me he was just being a boy.
Well, we use something called the DSM-4, which is a manual that aids in diagnosing disorders. I feel confident in classifying Anthony with attention deficit hyperactivity disorder.
You're saying my son has ADHD?
Yeah, there are two domains which I feel are important for me to tell you about. First, there's inattention, which has symptoms related to forgetfulness, common careless mistakes, and difficulty completing tasks. The second domain, and where I'm confident to classify Anthony, would be hyperactivity and impulsivity. The manual does list 9 symptoms, and after spending time with Anthony and talking to both him and his teachers, I feel like he's met 7 of these symptoms. The symptoms have lasted well beyond 6 months, and they have been impeding his everyday lifestyle in a negative way, which fall in line with the manual's diagnostic criteria.
Oh my gosh, my poor baby's been suffering, and I didn't understand what he's going through. What causes this disorder?
Well, there are many theorized causes, but I'd first like to emphasize that it is not a product of laziness or low intelligence,
Okay.
which unfortunately is commonly thought. The main cause is usually attributed to genetics, so it's likely that he did pick up the gene somewhere. Also, it could be an environmental cause. He might have had exposure to a toxic substance such as lead.
I always felt something was not right with Anthony. It's something I've heard of before, but I've never really looked into. How should I approach this?
In these types of cases, I can see a little bit of patience and understanding going a long way. There are a number of treatment options that we can discuss to help Anthony and find the ones that do work best for him. My first suggestion would be providing Anthony with a stimulant that would help regulate his attention and behavior.
You want to put my son on drugs?
Yes, it is a very effective treatment method when used in its proper setting. I know it has a negative stigma, but it will help Anthony a great deal. They will help him perform better in school and be more controlled at home. It'll reduce his fidgeting, he won't interrupt as much, and it'll allow you and your husband to have a much better relationship with him.
Okay, yeah, that all sounds very good.
Yeah, and with the few other methods, I'm confident that Anthony will be able to adjust really well.
Anything else besides drugs?
Well, like small things like allowing Anthony to spend more time outside and get a lot of exercise, that would help lower his hyperactivity. You can also try something called behavior modification.
What is that?
Basically, it's a system where you reward his good behaviors and meet his poor behaviors with consequences. I would also encourage that you take part in counseling to be better educated on the disorder, and I feel that would help a great deal. Also, attending support groups will help, as you can meet families in similar situations, which might aid in working through some frustrations. Overall, though, just allow yourself to have a better understanding of your son and be empathetic. That will go a long way here and will allow your family to build a strong relationship and produce many positive outcomes. Of course, we can discuss these options in more detail and answer any questions you might have as we work with Anthony, but I feel that he will be able to soon adjust and be a much happier child.
Thank you so much,
Thank
Dr.
you.
Zadeh.
Parental tips for children with ADHD. Become educated. Talk to your doctor and child psychologist about ways to deal with the everyday challenges of raising a child with ADHD. Join support groups to talk to other parents that are dealing with the same situation. Share this information with other family members and teachers to create an inviting and structured environment for your child. Take part in family therapy. Family therapy allows the whole family the opportunity to come together in a safe place. This allows people close to the child to get issues out in the open. Family members can then work to address, process, and solve these issues. Create a structured schedule. Structure the home in order to avoid problem situations. Create a setting that is structured, predictable, and motivating. This can help to mask many troubling symptoms of ADHD. Make sure you and your spouse are in agreement about parenting styles and provide support to one another. Provide relief and respite by giving each other needed parenting breaks. Age is just a number. Remember that children with ADHD need more supervision. Don't expect your child to perform at the same level as other children with the same chronological age. Know your own child. Have expectations that are appropriate for your child. Take time for yourself. Parents often neglect this very important tip. When you are stressed, your ability to care for others is impaired, so schedule me time every day. Finally, just remember that there are other parents dealing with the same issues and know that you are not alone.